So now what we're going to have a look at is lower limb immobilisation. We use this technique if we've got a potential fracture, dislocation or damage to a lower limb itself. Anything below the pelvis down to the knee, right down to the tip of the toe. What we're going to do is we normally have one good leg, one bad leg. If we move the limbs, we have to move the good limb to the bad limb because we want to move the bad limb as little as possible. And the whole idea about this technique is to give stability to the bad leg. We're going to need three things. We're going to need 3 triangular dressings. We are potentially going to need something to give us some support for the hollows between the legs themselves. And another little tip is to have an extra rubber glove available because that will come in useful and you'll see how that's used in a moment. So, the points we immobilise. We need to take out the flexible joint. So we need to put one triangular bandage above the knee, taking out the neck of femur and the femur itself and stabilising that with the pelvis. We then need to go below the knee, stabilising the tib and fib and the patella itself. And the final one is a figure of 8 around the feet to stabilise the feet and keep the feet together. Basically, we're splinting the poor leg against the good leg. So, if we imagine for this scenario that the left leg is the leg that is injured, we're going to bring the right leg to the left leg. When the feet are together, you'll notice there is a gap between the two legs. Everybody will be different, but where you've got a large gap or a reasonable gap, it's quite often good to pack that with a rolled up blanket, a jumper, anything that will give us some support and some stability between the two knees. We don't want the flex in when we tighten the bandages up. So the next thing we're going to do that will make this a lot easier is we're going to control the 2 feet. Now normally we will control the 2 feet and keep them together with the knees, and then comes the rubber glove trick. If you take a rubber glove, a spare rubber glove, open the glove and pop it over the toes, it supports the legs, keeps the feet together while we do the strapping. So then we're going to get the triangular bandage and we're going to roll the triangular bandage up to form a strap or a tie-off point. We're going to use the hollows under the knee, under the ankles, and then we will feed up or down. So if we go at the back of the knee and feed the actual support underneath and go above the knee, we take the second triangular bandage, repeat the process, under the knee again, and come below the knees, and then we take the final triangular bandage, again, roll it up, go under the heels and feed underneath the back of the ankles. So the first one we're going to apply is the figure of 8 around the feet itself. We cross and put a loop and tie. That brings the ankles together. We then take the loop around the base of the feet and tie off at the bottom of the feet. That keeps the feet together, keeps the legs together and gives us some stability in the lower limb area. Remember though, we can't tie off and should never put the strapping over where the fracture site or the damaged site is. If we've got fractured ankles, we wouldn't use this, we would just use around the feet or use the rubber glove on its own. Again, with mid-shaft, tib and fib or femur fractures, we need to make sure we're not tying off over the fracture site. We then come across, again, supporting below the knees and tying off, and above the knees and tying off. And what we've now created is a fixed point for the fracture, stabilising it, allowing us now to move the patient without disturbing, moving, flexing or doing any more damage to the injury site itself. Above, below the knee, figure of 8 around the feet, packing down between the two, and the rubber glove at this point can either be taken off or left in situ because the feet are now fixed with a figure of 8 around the feet themselves. Lower limb immobilisation.